This is the Brown Emergency Ultrasound Case of the Month for March. This is by Andrew Beck, one of our first-year residents. This is a case of a 56-year-old female. She comes into the emergency room complaining about acute, rapidly progressing swelling underneath her right mandible, and also said something about a, quote, huge vein, end quote, under her tongue. She also endorsed some occasional foul taste in her mouth. A bedside ultrasound was performed, and this is the longitudinal view. You'll notice a salivary gland here, and the things to take note of are some inflammatory changes and also this anechoic region in the gland, which represents both ductal and hilar dilatation. The transverse view of the gland is shown here. Again, you can see inflammatory changes and some ductal and hilar fullness. So when would you think to do a salivary ultrasound? So this is an ultrasound you might do when someone has some soft tissue swelling or a mass in the neck. You might be looking for a salivary stone or for inflammation of the salivary gland. To perform the ultrasound, you're going to have the patient supine and have them extend their neck. You're going to use the linear probe, which is the high-frequency probe. And just like with everything else, you're going to look at that structure in two planes. So you want to evaluate the gland in both the longitudinal and the transverse plane. A normal gland is going to be a uniform architecture, and you may visualize a duct, and if at all, it will be a small stripe, or you may not see that duct at all. You're going to want to compare the left and the right side to see what the abnormal side looks like in comparison to the normal gland. And you're going to assess for their size of the gland, for vascularity that could be increased in the setting of inflammation, or any ductal dilatation. Here's an example of a normal salivary gland. You can see that there's uniform architecture here, and you're not able to see the duct or the hilum. In contrast, here's an abnormal gland where you've got a non-uniform architecture, you've got some dilatation of the duct, and you're also getting some dilatation of the hilum. And finally, another example of an abnormal gland. This is a gland where you can see an actual stone inside the gland, and then you can see that that's resulting in some dilatation in the duct. And this is an example of a salivary duct stone.